In the 1980s, researchers at the University of Arizona created a new molecule. And when they gave it to people, it made them tan, vomit, nauseous, but also erect and sexually aroused. That's the history of PT141. And if that's not confusing enough, it's even more confusing today with all the advertisements and things like that. My name is Robert from Shameless Care, and today I'm going to tell you all about PT141, just the science. What the researchers at the University of Arizona was trying to make was a medication that makes you tan. But when they saw the sexual response in terms of the erections and increase in sexual arousal, they decided to split the molecule into something that just handles the sexual side of things and tried to take away the tanning component. That was eventually sold to a company called Palatine Technologies, which pursued FDA clinical trials for both men's erectile dysfunction and female sexual arousal. Now, that was under nasal spray. We're going to talk about different ways you take this medication later, but that was with the nasal spray. And both of those clinical trials were stopped because of transient increases in blood pressure. But the female one was restarted with an injectable medication, and that is now actually FDA approved, and it's called Vylessi. Vylessi is FDA approved for premenopausal women who have hypoactive sexual activity disorder. And that means women who have such a low sex drive that it's causing them distress. So if it's going to be prescribed today by a doctor for men or for postmenopausal women, then it's going to have to be prescribed in a way that's known as off-label. But essentially it means prescribing a medication for a reason that it's not particularly FDA approved for. So PT141 can be prescribed to premenopausal women under the trade name Vylessi as an FDA-approved medication, or off-label to men and older women if you can find a physician that is willing to do that very thing. Now, before you talk to a doctor about PT141, you first need to know if it works. We're going to focus on women first because remember, in women, premenopausal women anyway, it's FDA approved. We have the clinical trial data. There is no better data than that. But what you will find is that the results are maybe a little bit more subtle than what you had hoped for. If you look at this chart comparing PT141 to a placebo, on a questionnaire measuring sexual thoughts and desire, women taking PT141 improved, but only by about 0.3 to 0.4 points more than placebo. And that's statistically significant, and it was enough to earn FDA approval, but it wasn't exactly a home run. Now, that's not to say that Vylessi doesn't help a lot of women. I'm sure that it certainly does. But my point here is that when people are really struggling with lack of sexual thoughts and desire, and they seek out a medication and they're prescribed that medication, and if it doesn't work for them, well, that's really disappointing. And so I think that people just need to realize that these medications have limitations and that for some people they work quite well. And for other people, well, those people shouldn't be surprised if they don't do the thing they were hoping that it does. Now let's focus on men. Now with men, there are plenty of studies, but the truth is we don't have that clinical trial data. But the studies that are available, and I'm going to put 3 in the description of the video, you can take a look at them themselves. Essentially, they all show an improvement in sexual arousal and erection quality for men, which is really exciting. But this has not been through the clinical trial data, and it's not FDA approved for this purpose. Now let's talk about format, because this really matters. So you have injectable PT141, you have nasal spray, and then you have sublingual troches. Now let's focus on the sublingual troches first. This is where you have a medication that absorbs under your tongue. Now listen to me very carefully, guys. Although there are telehealth companies selling this very thing, at the time that I make this video, so far as I am aware, there is no evidence that PT141 can be absorbed sublingually. And the only evidence that exists is a single study in beagles, which shows basically no absorption orally with PT141. It is a large peptide. It is not supposed that it will absorb in that way. Let me put it this way. If you put a PT141 troche on trial and you tried to convict it of increasing the number of PT141 in the body enough to have any meaningful effect, it would be exonerated. There would not be enough evidence to convict it, and I will simply leave it at that. So now we will talk about nasal spray and injections. Vylessi, the FDA-approved version of PT141, is an injection, and that is going to have the highest level of absorption. Nasal spray also has absorption. Some of the earliest clinical trials were with nasal spray, and there is a load of evidence. What you need to understand is that Injections, you're going to have higher absorption, also more consistent dosing. Anytime you do a nasal spray, the dose has to be higher because the absorption is lower. And also, the absorption can be not quite as consistent because it's going to absorb differently at different times, depending upon the person, depending upon the amount of mucus in their nose, and things like that. But both of these are completely appropriate. So how can you get PT141? Well, there's essentially three ways in the United States right now. One is the FDA-approved Vylessi. If you happen to be a premenopausal woman with diagnosed hypoactive sexual activity disorder, then you can have a physician write you a prescription for that, and you can pick it up at a CVS or a Walgreens or other sort of mainstream dispensing pharmacy. The other is to get it prescribed off-label and made by a compounding pharmacy, and that is something that we do at Shameless Care, and several other telehealth platforms do as well. And the third way is to buy it from a wink-wink retailer that is selling peptides directly from overseas, labeled as not for human consumption or labeled for research purposes only. Now, there has been case after case of tests done on these sort of gray market peptides, which show that the dosing can be all over the place. Some of it has virtually no active ingredient. Sometimes it has way too much. Sometimes the purity is not correct. Look, I know I'm going to catch heat for this because there are millions of people in the United States that are biohacking by buying medications from companies that are selling them to the public with a wink and a nod, not for human consumption. I would not inject something into my body that was sold as not for human consumption and had avoided the entire process of a legitimate healthcare system. But obviously, different people make different choices. I'm just telling you from my perspective, I would want to get it from a licensed physician and a real pharmacy in the United States. But you guys do whatever it is that you wish to do. My name is Robert from Shameless Care. Thank you so much for watching this. If you learned anything, please drop us a like and a subscribe. Take care.